Okay, so we were in group 3 and focusing on improving state-level measurement systems and system-level data to promote children's cognitive, affective, and behavioral health. And a number of the things that we discussed in our breakout group have been mentioned in the first presentation and the second presentation, so I'm not going to duplicate a lot of things. I want to bring up some of the issues that we discussed that haven't been addressed yet. So our first question really focused in on, dealing with some of the biggest gaps in measurement at the state level. And we focus a lot in our group around the issue of integrated data or integrating data at the state level, and in order to monitor health outcomes. And we talked a lot about how we talked about a lot of different issues. It was a very interesting breakout group, but there were a number of issues even within a state around different departments at the state level not sharing information with each other at that level. And so that's one barrier that we could potentially address. And then we also talked about examples where states were able to integrate data across different departments. And one of the things we talked about later on in terms of what we can do about that is felt like it would really be useful to do some sort of a scan of what's going on in states, how they're sharing data, how they're using data, and look for good examples of models that we could then disseminate more broadly to potentially get more states taking on this task. And we talked about the fact that there are a number of challenges and issues with how you integrate data at the state level, from the ethical issues all the way down to the practical issues of not having adequate infrastructure to really support integration of data or the use of big data or large data systems at the state level and linking that even to the local level. It was also brought up in our group that an issue that even supersedes that is the lack of use of the federal data that exists, and states not having an adequate understanding necessarily of the federal data sets that are out there that they could be using, and even using to drill down to the local community level, and how there was a need to get that information out around children's issues. Let's see. So system fragmentation was brought up at a number of different points in our discussion, and we turned a lot to Illinois that, since we had Gergely, since we had Robert in our group, to really use Illinois as an example of how did they do it, how do they go about it. And I think we need to make use of more of those examples. We also talked a lot about some practical barriers to developing state-level data systems, and Catherine brought up some of the practical barriers around just developing memorandums of understanding between researchers and other agencies to collect data, to use data in order to develop the data systems that they actually want to have within a state. And how that, in order to really do this effectively, it really requires looking at staffing patterns that are available to do this work. We also talked about the kinds of data that we should be collecting, and Rico brought up a lot during our discussion the need to have better assessment of predictor variables like risk and protective factors at the state level, and gave examples of work that is being done like that and how we need to learn from that and then sort of increase the spread of that kind of data collection across the states. We also talked about how now is the time to really get in on the development of systems for electronic health record data collection, especially with regard to young children, because currently young children are not being focused on adequately, and that we need to think about working directly with software developers to understand what types of data we need to collect, how to go about collecting that data and building it in now and versus trying to do that on the back end once these electronic health record systems are up and running. Another issue that came up in our group that was very interesting was when we go about developing state systems for data collection, and we're collecting data at the local level that will then either trickle up to the state level or be used in some other way, how we are inadvertently increasing the burden on the staff without them really understanding the purpose. You know, the reason why we're asking them to collect data. And they may already be collecting data for one type of program, and then they're being asked to collect data for another type of program. And just thinking about the fact that we need to really continue to work on having buy-in at all levels when we're talking about collecting data for states, that requires the actual data collection to be done by the frontline staff. And that's in just about every system you could think about where that would take place. Let's see. Those were some of the big issues that we talked about. We talked about a lot of different things. I have about 7 pages of notes for the meeting planners here to take back and synthesize. And right now, I just want to turn it over to the folks who were in the breakout group to see if there are any important issues that I didn't mention in brief here that you want to make sure we get on the record. No? Okay.